afternoon. My name is Dr. Alex, an eye specialist from Alex and Associates Eye Care Center, Kitengela. Today we want to talk about refractive error, and by definition, refractive error is a defect that is caused in the eye by an inaccurate bending of light towards the retina. Now, refractive error is categorized into four. We have the first category is called short-sightedness or myopia. The second category of refractive error is called long-sightedness or hypermetropia. The third category of refractive error is called astigmatism. And the last category of the refractive error is called presbyopia. Now, what is myopia or short-sightedness? Short-sightedness is a defect in the eye whereby a person is unable to focus on distant object, while hypermetropia or long-sightedness is a defect whereby a person is unable to focus on near objects. Astigmatism is a defect whereby objects will appear to be like they are bending, while presbyopia is a defect similar to hypermetropia or long-sightedness, but in presbyopia it is being caused or it is being brought about by age. So this category is affecting adults from 40 years and above, and it is more or less the same as hypermetropia, though the difference is in hypermetropia it can affect both young children and adults, while presbyopia only affects adults. What are signs and symptoms of refractive error? We have various types of signs and symptoms of refractive error, but I'll only talk about the common ones. Number one sign and symptom of refractive error is blur vision. Blur vision is whereby some patient will complain about not seeing clearly either at a distance or near. Sometimes a client might also complain about images appearing to be bending. Sometimes somebody can complain about double vision. Sometimes we complain or some people complain about headache. And in this case, they will talk about frontal headache or temporal headache. We also have, I've talked about double vision, I've talked about blur vision, I've talked about headache, among others. So how will you know that you have a refractive error, or how will you differentiate that the headache you are having is caused by refractive error but not any other illness in the body? So for you to know that you have a refractive error, you must go for an eye checkup. You must visit an eye specialist, in this case an optometrist, who will take you through some examination. And the first examination that you will be taken through is called visual acuity. Visual acuity will help us to know how far or how best you can read or you can see objects, both from distance and from near. So for example, in this case, now the optometrist will put you to read a chart like this over here. Now this chart, it has got letters. Like for example, here you can see that letter is bold, and as we move downwards, the sizes of these letters reduces. So we shall know how best or how far can you read. Then this visual acuity will help us to determine what kind of refractive error you are having. But before we go there, before we can tell you which kind of refractive error you are having, from visual acuity we shall take you to be examined. We shall take you to the examination room, and in our examination room we will test you through. We'll do for you what is called retinoscopy. And retinoscopy, we will use a machine like this. This machine is always very accurate because whatever we are going to get here, we are going to test you using this machine to determine which kind of refractive error you are having. This is called retinoscopy, the process through which we are determining the kind of refractive error you are having. Or we might also take you through computerized eye checkup. This machine over here will also give us an accurate, it is also very much accurate. So through this machine, after we have tested you from either computerized eye checkup or we've used some optometrists will refer using retinoscope, including myself. I like retinoscopy than computerized machine. So from there, we shall take you back to the visual acuity with the prescription we found now to do for you what is called, okay, inside here, through retinoscopy, that is called subjective test. So from subjective test, we'll bring you back to our visual acuity chart to do for you objective test. Now from here, we shall use these trial lenses to determine which kind of lens you are lacking in your eyes. Okay, maybe one thing I need to put clear before I come to this chart is that when you are short-sighted, it simply means that the dioptic power, the power that your eyes requires, is on the higher side. It is above the required power in the eyes. So for myopia or short-sightedness, after we have tested you from the examination room, then definitely we shall give you a lens that will reduce the excess power you are having from your eye lens to come back to the normal power. For hypermetropia, it means you have less power as compared to what your eyes requires. So we shall give you an additional power from our trial lenses to help you maintain or gain the power of the lens that, or the dioptic power that you are missing in your eyes. So from examination room, we shall bring you back here through use of trial frame and the trial lenses. We shall determine, or we shall know, what kind of correction you are required. Then from there, how do we manage refractive error? Refractive error, the most appropriate way of managing refractive error is through use of eyeglasses. There are other ways, like maybe you can use contact lens. We can also correct it through surgery. We call it refractive error surgical management. So you can use surgical management, which is a little bit expensive and time consuming. You can use contact lens, but not for contact lens. Then again, there are other factors we have to consider before you can use contact lens. Because, for example, if you have allergy or you have infection in your eyes, you cannot use contact lenses in this case. So the appropriate method of correcting refractive error is through use of eyeglasses. So once you have been examined, once you've been tested, and we know the kind of the kind of lens you are required, then you will come to choose a frame which is the frame of your favorite. Our sales ladies will help you choose the preferable lens. So we have got various types of frames which you will be told to choose through the help of our receptionist or our sales ladies. They will help you choose the lens, the frame that is going to fit your face. Then from there, we shall take this to the workshop for an optician to fit it for you. So from the workshop, after the optician has done the fitting, then you will be called to come for your eyeglasses. Before you walk out with them, you will be required to go and test it from the visual acuity chart to see if your defect has been corrected. Then we shall we shall review you maybe after 8 months or 1 year, depending on the heaviness, or rather the prescription that you are given. So feel free anytime, any day, if you have the symptoms that I've talked about, that is headache, that is blur vision, that is double vision, feel free to visit our facility, Alex and Associates Eye Care Center, which is situated in Kitengela. We also have branches at St. Paul's Hospital, Kitengela. We have another branch at Namanga. We have another branch at Basin. Feel free, because if you don't correct this refractive error, know that the end result can be either total blindness, or you can also have another defect called lazy eye. So when your eyes becomes lazy, it means even if we try to correct it using our lenses, it won't be corrected. And if you go blind, it can't be reversed. So don't wait until it reaches there. Visit us any day, anytime. Our office is open daily from 7 a.m. to 7 p.m. during this corona time, Monday to Saturday. Sundays we are always there on call. Our number is always there, 0712 136 721. Call us, reach us find us in Facebook, find us in YouTube, and we shall attend to you. Thank you very much, and be blessed.